segues to talk about masks and their significance, I suppose.
Yep.
So new to a lot of students, they're going to come into school wearing masks and leave school wearing masks as well.
Yep.
Teachers also in our school wearing masks as well. So how effective is wearing a mask? And without masks, can the infection spread more easily to others?
So if you don't wear a mask, you can spread the virus very, very effectively. So if there's two people in a room and they're closer than 2 meters to each other, and neither of them are wearing a mask and one of them has COVID, the risk that they will spread COVID to the other person is very, very, very high. If both people are wearing a mask and one of those people has COVID, the risk that one or other will infect the other with COVID is reduced by anywhere up to 95%. So it's really, really protective if both people are wearing a mask. And I think the reason why we're wearing a mask is, yes, it does protect you, but more importantly, it protects other people as well. So really, really effective.
And do masks completely stop your chances of getting COVID-19?
They don't completely, but if you wear the mask correctly, it reduces your risk by up to 95%. So not 100%, but as good as.
So we're going to ask you really, like, how best to actually wear a mask. How would you put it on and off properly, essentially? So would it be okay if you did a little demo for us?
Yep, so these are 2 clean masks. There's a few things about the mask that are important. So the first thing is, ideally when you're putting a mask on, it should be clean. The second thing is when you're taking the mask off, you should put it into a plastic bag, and ideally a Ziploc bag when you're not wearing it. And the third thing is that you should wash the mask frequently. So first thing is, before you put a mask on, you wash your hands, and you wash it well and thoroughly for about 20 seconds. And then when you're putting the mask on, try to focus the attention on the ear loops, so try to put it on using the ear loops. So once you've washed your hands, you put the mask on using your ear loops like this. And then what you do is you adjust the mask. And so for example, you make sure that it's really comfortable around the back, you make sure that it's fitting well, you make sure that it's got a good seal around your nose and a good seal around your chin. Because once the mask is on, you shouldn't touch it until it comes the time to take it off. So once it's on, no more touching the front of the mask. When you want to take the mask off, then what you do is you wash your hands again for 20 seconds, and you take it off using the ear loops at the back. So you take it off using both your hands, and ideally what you would do is you put the mask then directly into a Ziploc plastic bag, and then you wash your hands one more time. It's really important that you wash your hands before you take it off, because if, for example, somebody coughs on you that has COVID, the COVID will be deposited towards the front of the mask, so that will keep you really safe. But then if you touch the front of the mask and you touch your face, what you're doing is infecting yourself. So it's really important that you wash your hands before you take it off, and then immediately afterwards as well. And then you put it into a Ziploc bag. And then if you have 2 or 3 masks with you, what you should do is, if you can, put a clean mask on every time. If not, make sure that you put it on correctly. And then when you go home, you put the mask into a 60-degree wash, and you bring in a new set of masks every single day.
So just to kind of place emphasis on what you said there about storing the mask. I know for a lot of students, the easiest thing might be to finish class when they're going out for break, perhaps take off the mask and store it down in the pocket or into the bottom of the bag or whatever it might be.
Yeah.
So you're recommending a Ziploc bag, is it?
Yeah, I mean, the reason I use a Ziploc bag is because you can lock it tight, and what you can do is you basically put it into the Ziploc bag, and then you can just put it directly into your pocket or directly into your bag. The reason why we don't want people to put the masks into their pocket or into the bag is there's a lot of stuff in your pocket, there's a lot of stuff in your bag, and you have to think that you're going to be wearing this mask and it's going to be touching your face. So ideally what you want to do is to make sure that it's as clean as possible. So you put it into a Ziploc bag, and you can put it into your pocket or into your bag, no problem. The other thing you have to remember is if you are wearing the mask for a few hours and you're walking around, again, somebody could have been coughing onto your bag, onto the front of your mask. And again, putting that mask into your bag, you could be infecting things within the bag. So it's just a good idea to keep it in a Ziploc bag if you can. And then what you do with after that is your own business.
That's actually very interesting. And you mentioned there that you should wash your mask on a 60-degree wash. One of the questions that we had also was, how long did you suggest that you wear your mask for before having to put it into a wash?
So I suppose if you're in an ideal world, if you're being really perfect about it, what you would do is you'd only ever use the mask the once. So once you put it on, you leave it on for as long as you can, and then you take it off and then you'd wash it. But I understand that that's not practical. So the most important thing, if you're reusing the same mask that day, is that you put it on, you take it off correctly, and then that's going to be safe. But ideally what you would do is you would wash it at the end of that day.
There's another question that we actually got from one of our students, and they were wondering, with regards to coughing and sneezing, do you do that into the mask, or do you still go about into the elbow?
So you cough and sneeze into the mask and then into your elbow, and you take the mask off and you put the So the reason is, number one, it's going to be really uncomfortable because you've coughed into it, and the second thing, it's not hygienic. So that's why it's always a good idea to have more than one mask with you in case that happens. So you cough into the mask, and when you're coughing, you also cough into the class. There's going to be a large number of people around you. So if you cough both into the mask and into your sleeve, the risk that you would cough or sneeze anywhere else would really reduced.
And I suppose then, on that note, I suppose it would be best then for students to try their best to have multiple masks with them each day in school.
Yeah, so what I've told my patients who are students of mine is to have 3 with them, if they can, because they're going to take them off at each break, probably. So what I've advised is, if it's possible at all, to have 3 with them. And in terms of, I get asked all the time, how many masks do I need? The number I use is 6, it's just because it might be putting them under pressure getting her to wash the masks every single day. But the reality is, I mean, my neighbour made me 8 of these. You don't need to buy fancy masks. I see people going around branded ones. Like, you can make them at home on YouTube, very simple and very, very cheap. So 6 masks ideally are as many as you can have.
And why is it unsafe to wear the mask and then place it down on your chin and then place it back up again to your face?
Yeah, and that's really important, because I suppose one of the things that does irritate me is people are wearing masks the wrong way, and if you don't wear the mask correctly, it can actually increase your risk of getting infected. So I'm just going to use an example. So let's say you're wearing the mask for the whole day and somebody's coughing on you. So we were saying it's droplet spread. So somebody could cough on your neck. You could have COVID on your neck, totally fine, it's not causing any problems, but there are some COVID droplets on your neck. And if you pull the mask down and you rub it against your neck and you pull it back up again, you're just going to infect yourself with COVID. So that's the most important reason, and that's why also that you need to get it to cover both your chin and your nose, because that will ensure that you're perfectly protected. But the commonest mistake is people wear it around their neck, and actually that's a big risk, because you could actually not only be not protecting yourself, but actually increasing the risk of getting infected with it.
So obviously in the business of masks, there's a lot of masks out there. There's so much choice for us at the moment, and you can also make your masks and so on. So what type of mask, I suppose, is best, and how can you tell if the mask is going to be good enough to protect you?
Yeah, so I suppose the first thing I'd say is I wouldn't recommend disposable ones, because they're really expensive, and if everyone wears disposable masks, they'll be more expensive for doctors and nurses, so disposable masks are not a good idea. What I would recommend doing is actually making your own mask. It's super cheap, and it's very easy to do it if you watch a YouTube video, as long as you use what are called 3 layers of cotton, so 3-ply masks, so not just 1 but 3. But all of the YouTube videos will go through that with you, and it's a nice simple thing to do, and it means that your mask is unique and no one else has one. Otherwise, basically you buy a cotton mask, and all of the ones that are for sale have to adhere to that, so at least 3-ply. You can get really fancy ones that have vents and filters in them. They're as good as cotton masks, but really expensive, so I wouldn't recommend them at all. So as long as they're made from cotton and that they're a minimum of 3-ply, which is what they're saying, they're fine. But I think it's a good opportunity for people to recycle their old clothes and to make them themselves.
And obviously with mask wearing, this may, it's a new material on our skin, may have different effects. So for those students who may have sensitive skin, is there any type of mask or material which would be recommended for sensitive skin?
Yeah, so silk masks that are good, expensive, but they're hypoallergenic, so they don't irritate your skin. I suppose the reality is we're seeing a new thing now, which is mask acne. So I suppose students would normally get acne, they're in that age group, and because when you put the mask on, it can make your skin produce more oil. So if you wanted to buy a mask, it would be a silk mask, but actually the most important thing to do is to talk to your GP, because what we can do is help control that production of oil. Because the acne that you get from a mask is very similar to the acne that you would normally get. So we as your GPs can help manage that, so just give us a shout and we can sort that out.
And what can students do, so if they're wearing glasses as well as masks, how can they prevent those glasses, I suppose, from fogging up so much or throughout the day? Is there any tips for that?
Yeah, there's 3 things you can do. The most expensive option is to buy anti-fog spray, which is expensive and works really well, but you end up going through a lot of that. The other 2 options are you can wash it with warm soapy water or use shaving gel. Whether you use the shaving gel or the warm soapy water, what you do is you rinse it and let it air dry, so not to wipe it down with a towel or tissue. So use either shaving cream and warm soapy water, rinse it down and let it air dry, and that should give you a few hours of fog-free classwork.
Brilliant. And why do some teachers, I suppose teachers are going to be wearing visors or masks depending, so why do some teachers wear visors instead of masks?
So we know that masks are better than visors, but there are some situations where wearing a mask isn't practical. So one of the issues with masks are it can make it difficult to hear people, is the first thing. And the second thing is, if there's anyone in the class who's hard of hearing, it's impossible to live if somebody has a mask. And so there are some cases that a lot of teachers would wear visors, and that's because, number one, they'll have to project their voice, and it'll make it easier for children to hear them when they're wearing a visor. But secondly, if there is anyone in the class that's hard of hearing, it allows them to lip read.